Good afternoon, everybody. Welcome to the City of Toronto's daily COVID-19 media briefing for Friday, March 27th. For those online, again, we will mute you here, or unmute you rather here, so you can leave your computers on off mute. That would be great. Today we are joined by Mayor John Tory, the Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Fire Chief and General Manager of the City's Office of Emergency Management, Matthew Pegg. Mayor Tory.
Thank you, Brad, very much. May I begin today by applauding Prime Minister Justin Trudeau for announcing today that the Government of Canada will be covering 75% of wages for qualifying small and medium-sized businesses to avoid layoffs, and that this new assistance will be backdated to March 15th. This is good news for many workers and businesses and all the families who rely on them after a lot of bad news over the last few weeks. The Medical Officer of Health has educated me on the fact that this kind of anxiety caused by financial stress and so on can itself have health consequences for people who have enough health worries on their mind as it is. I should say that what was brought forward today by the Government of Canada was almost exactly what our tech, small business, manufacturing and restaurant sectors, just as examples, told me would help the most to save businesses and jobs. Alongside others, I conveyed these requirements and ideas to the Government of Canada, and I want to pay tribute in particular to Finance Minister Bill Morneau and to Deputy Prime Minister Chrystia Freeland for the fact that they closely listened to what everyone was saying and they acted on what they heard. It is a significant measure the federal government is uniquely poised to undertake, and it is definitely the right thing to do. These measures, also including the deferral of some payments to government, such as the HST, will be a lifeline which preserves jobs, preserves businesses, and helps to protect the economic success we were enjoying before the virus struck. Coupled with measures taken by the province in their economic update this week and actions the City has taken, including the 60-day grace period for City of Toronto tax, water, and waste utility payments for residents and businesses who need help, we are all working together, all three orders of government, to provide relief to people and to businesses. Time is of the essence, so I hope that all of us can deliver on all of these measures as soon as possible. We are all responding to tough times with right and responsible actions. That's what we all should be doing, and I know that's what so many people are doing across the city in their own lives, helping family and friends to get through this. That's the Toronto spirit, and that's how we will survive these difficult times. Although many people, I think, have responded to this pandemic in a positive way and as best one can, there are still cases that are frustrating and, quite frankly, outright disturbing. Chief Pegg will update you on enforcement action we are continuing to have to take for some non-essential businesses that have not closed. This is not optional. If you're not essential, if you are non-essential, you have to shut down to avoid further spreading of the virus and, quite frankly, to avoid sanctions. It puts our whole community at risk, and it shouldn't still be happening. We will continue to send our people out to all areas to make sure there is compliance with the rules that have been put in place based on the best medical advice and based as well, quite frankly, on respect for the law. I understand that some President's Choice, Loblaws and Shoppers customers were advised in an email today that there are growing reports of people ignoring social distancing while shopping. Shopping in groups, bringing family to shopping as if it's a social outing of some kind, or even some people, just awful human beings, making jokes to some of the people working in those stores doing good work for all of us about being COVID positive. This kind of behavior is disrespectful, it's irresponsible, and when it comes to cracking jokes about the deadly virus, it is really just dangerous. And I noticed that Mr. Weston wrote to people to say that hopefully this kind of thing won't happen. I suspect most of the people he's writing to are not the people doing it, but it is behavior that we just really can't in any way countenance during an emergency like this. And I'm calling it out today in the hope that people will get the message and do the right thing, even people inclined to do that sort of thing. While we're working hard to get everybody through this pandemic, I think it is really important today to reiterate the action that we all need to take tonight on a beautiful sunny spring day and into the weekend. Stay home. Please stay home. I'm asking people to stay home as much as possible this weekend and next week. It goes contrary to everything we want to do when the early days of spring come upon us and when the kids have been cooped up and they want to be outside. But please stay home in order to help us to stop the spread of the COVID-19 virus. It is difficult at this time of year when spring is here and the winter is finally over. And I know there's only so much Netflix to watch and so much to do around houses or apartments that people live in. But we really do continue to need people's help on this today and tomorrow and for some time to come. Now is our chance to help save lives. All of us can contribute to saving lives, literally saving lives in our city. If we're going to stop the spread of this deadly virus, a virus that we've seen is very easy to pass on to people of all ages, then we must limit our physical interactions with other people. This is the advice that's been provided over and over again by our Chief Medical Officer of Health and by other health professionals across Canada and indeed around the world. You can still connect with people, whether it's through FaceTime, whether it's through email, whether it's through just picking up a phone and calling people, as we used to do a long time ago when these other means of communication weren't available. And that's important right now, too, to talk to each other, to support each other, and so on. But it's just the visits and the interactions and the group outings that are things that we've been told by our professional advisors are going to hurt and not help. But the most important thing is to stay home. The medical advice is clear. The best way to slow the spread of this virus and flatten that curve is to stay home and keep our distance from each other. It doesn't sound much like spring, but really the only time we're going to see a spring when it comes to a spring of this long winter of devastating effects from this virus is if we follow that advice. So please do that and try as best you can to enjoy the weekend, notwithstanding these restrictions on the activities of all of us. And I now, on that note, will turn the podium over to our Chief Medical Officer of Health, Dr. Eileen de Villa.
Thank you, Mr. Mayor, and good afternoon, everybody. As of 1 o'clock this afternoon, there are 457 confirmed cases of COVID-19 in Toronto, and this is up 118 from yesterday. There are 29 cases hospitalized, 15 in ICU. Approximately 25% of the cases are attributed to community spread, and 18 people have recovered. These numbers are, as always, constantly changing, and they are indeed increasing. We are seeing a significant increase, and I expect that we will continue to see similar patterns in the coming days ahead. As I've recently stated, you can be infected with COVID-19 and not know it. For most people, it takes about 5 or 6 days before they show symptoms of illness. For others, it can take up to 14 days. And there can be a number of days from the time you show symptoms to when you get tested and then receive the results of the test. We also know that March break recently ended, and there's been an increased number of travelers returning back to our city, many of whom are returning from destinations where COVID-19 is actively circulating. What this means, taken all together, is that the positive tests that we're getting now are the result of infections that happened several days ago. This is why I continue to urge people to practice physical distancing. I continue to be troubled by some of the stories I hear of people who continue to ignore social distancing or physical distancing. As we've just heard from Mayor Tory, there are stories of people shopping for groceries and essential supplies in groups or as a family, treating shopping as a social outing. And while under normal circumstances, these kinds of actions may seem harmless, they are very concerning in our current situation. If we continue to see people selfishly ignore the recommendations that have been put in place to keep us safe, we should prepare to continue to see dramatic increases in local numbers. Please take every action that you can to respectfully practice physical distancing at this very critical time. If you are not willing to do this for yourself, then I would ask that you do this for your loved ones. The physical distancing measures we are asking you to take are critical to our health, both as individuals and as a city. We also need to ensure that we're taking care of our mental health. Everyone has different ways to cope with the challenges we're facing, and so much has changed in our world since this virus was first identified in January. We've watched this virus spread across the world and cause all of our lives to change. It's understandable that these uncertainties are causing people to feel anxious or worried about their future. But we know that staying home and keeping 6 feet of distance from all others is one of our best defenses to fight this virus. We understand that spending a lot of time at home can create new stresses. Looking after your mental health is, of course, as important as taking care of your physical health. And there are many things that we can do to keep mental health on track. For example, simple breathing exercises or meditation can help ease stress and activate relaxation. Eating healthy foods, fruits, vegetables, and drinking lots of water can also help people feel better. Getting active is a great way to reduce stress and to improve mood and overall health. And there are certainly plenty of ways that one can be active and exercise even within your own home. There are several videos on YouTube that can guide you through that. Staying connected with friends or loved ones by telephone, video calls, and text messaging. And I would encourage people to spend time talking to people who are a positive influence on you when you're feeling stressed. And I would encourage all of us to lean on each other for support. I also want to acknowledge at this time the tireless efforts of our healthcare, frontline, and essential services workers, including those that support people who are experiencing homelessness. We need to support these individuals. We need to support all these people at this critical time so that they can continue to care for our community. As we adapt to our current challenging circumstances, it is understandable to feel stressed and overwhelmed. It is important to find ways to stay connected while respecting physical distancing in our new reality. This will help us to stay emotionally healthy and resilient during this pandemic. I would also encourage those who may need further support to seek professional help. And on our website, we have posted community resources that you can look at and consider for your use. I've received many questions, finally, about how long physical distancing measures and non-essential business closures will last. The reality is that we need to be prepared for extended closures. Based on the experiences of other jurisdictions, such as Hong Kong, Singapore, and Japan, it took several weeks of strong public health measures to start to see the effects of social distancing, the effects of physical distancing. We are fighting an invisible war with this virus, and we need everyone to do their part. Please, continue to take the very responsible actions that I've been urging you to do. Stay home, stay safe, and take care of each other. I'll now turn it over to Chief Pegg.
Thank you, Dr. de Villa, and good afternoon. On Wednesday, the city announced that all city parks amenities are closed. This does not include the open green spaces within the parks. Only the amenities within those parks are no longer available to the public. All playgrounds, fitness equipment, sports fields, off-leash dog parks, fenced and unfenced, tennis courts, basketball courts, baseball diamonds, picnic areas, washrooms, garden allotments, skate and BMX parks, frisbee golf, and parking lots at city parks are closed to the public. Work continues on the installation of signage and to lock gates in parks where they exist and tape off other parks amenities to ensure public compliance in our collective efforts to help stop the spread of COVID-19. City Park green spaces, though, remain accessible to the public. As Dr. de Villa has said repeatedly, going for a walk and getting fresh air is healthy, provided you're not sick, in which case you must stay home and self-isolate. Of course, as always, you must ensure physical distancing, even if out walking through city parks. The city continues to deliver the essential and critical services the public requires, including emergency services, solid waste collection, safe drinking water and wastewater treatment, maintaining city infrastructure, and ensuring our most vulnerable continue to get the support and services they need in these difficult times. A plan is being finalized for Monday to ensure the safe and efficient distribution of Ontario Works and Ontario Disability Support Program checks. We will share those details with you as soon as they have been confirmed. I want to thank the city employees working behind the scenes that are keeping our workforce informed about COVID-19, ensuring staff deployment plans are continuously updated, and to acknowledge the tireless efforts of our finance and treasury staff. These are extremely challenging times for them all. Each is critical in our ongoing efforts to keep Toronto healthy, safe, and functioning. And thank you to the public who are doing the right thing in helping to stop the spread of this virus. Enforcement of the various orders and closures that have been put in place to keep Toronto as healthy and safe as possible and to ensure our healthcare system can continue to treat those who are sick continues. We all need to follow Dr. de Villa's advice to stay home if not performing an essential or critical service. Those who choose to ignore or defy the law and open businesses that are not essential or use public spaces that are closed for all of the reasons we have repeatedly stated will be fined. As of 11 a.m. today, Municipal Licensing and Standards has responded to 79 complaints since March the 24th and issued 10 notices for failure to comply with the provincial order to close non-essential business. Through our audit, we have issued an additional 6 notices and have re-inspected 11 locations that have now complied with the orders. We've received 90 complaints related to social distancing in city parks. Since Tuesday, Toronto Public Health attended 95 bars and restaurants that were identified as non-compliant last week. 49 of these are now closed, and 8 warning letters were issued for premises that were non-compliant with the prohibition on dine-in operations. If the public has a concern that non-compliance is occurring with respect to the closures, please call 311. There is a wealth of COVID-19 information on the city's website. Please make toronto.ca/COVID-19 your first source for credible and up-to-date information. As I always remind you, please do not call 911 unless there is an emergency that requires response by police, fire, or paramedics. I would like to finish by taking a few minutes to talk about something that is very important to me and to all of us, and that is mental health. We are in unprecedented times as we navigate the COVID-19 pandemic emergency together. I know that many people are feeling anxious, unsure, and even scared. First and foremost, it is okay not to feel okay about COVID-19 and about things like social distancing, self-isolation, and about the COVID-19 pandemic in general. These are normal and healthy responses and feelings to an abnormal situation. Being forced out of our normal daily routines and being distanced from our normal social networks, support groups, and friends is hard, and many are struggling as a result. In times like these, it can help to make an effort to let go of the things that we are not in control of. Reach out to friends in a safe way, including by phone, Skype, FaceTime, or other social platform. Stay active in your home. Focus on doing your best to eat well and to stay rested. These are all things that can help. If you or someone you know is in crisis or is feeling suicidal, you should immediately call 911. You can also access crisis support at crisisservicescanada.ca, by phone at 1-833-456-4566, or by text message at 456-4566. 888-888-8845. These services are available 24 hours a day, 7 days a week. There are also some excellent resources and advice available from our friends at Toronto Public Health. We have already posted much of this information on our various social media channels, and we will also post this information to the toronto.ca/COVID-19 website. Please take a few minutes to check in with your family, your friends, your colleagues, and anyone who you think may be struggling. We're all in this together, and the more we can do to support one another, the better off all of us will be. And know that we will be here, doing our very best to lead our city through this emergency and back to daily life in the great and awesome city that we all enjoy. Thank you.
Thank you, Chief. First question here to Matt Bingley from Global News.
Mayor Tory, yesterday you said that when you were talking to some of the businesses around delivery, you were being told about people who were gathering in hallways. I'm just wondering, I'm not sure who is the right person to answer, if this is Chief Pegg or even Dr. de Villa. When it comes to knowing that people are doing this in, under the guise of being indoors, what can the city do to try and enforce them to stay apart when they're on a private residence like that?
Well, perhaps I'll start just by saying the answer is not an awful lot in the context of all the buildings and all the hallways and all the places, and that's why you have to rely. We couldn't possibly have enough enforcement people to go to every hallway and see that people are not doing what they've been asked not to do, and in fact told not to do in some respects. So I guess you have to rely, as we do on many, many things in life, on the goodness of people and the common sense of people not to gather in hallways any more so than they should gather anywhere else. In a public park, in a grocery store, we're telling them don't gather anywhere. With great respect and with great humility, we ask them that. And so I would just say that that's why I talked about it yesterday, because we wanted people to know that that is not a substitute for, nor is it any more acceptable than a large gathering on the sidewalk or in a park or anywhere else. Don't gather, please. Stay home, stick to yourself, and do the distancing that Dr. de Villa talked about.
Are you hoping that, maybe just to follow up, Dr. de Villa, is there anything that you can do to maybe lean on, condo building owners or even landlords to try and ensure that they're keeping an eye on people and having their own security or concierges sort of watching over this?
Well, I know that we've put out information certainly for, condo owners and apartment management companies to try to support them to control the spread of virus in our community. But as Mr. Mayor says himself, I do think that it fundamentally boils down to each of us doing our very best in order to protect our community. And as I've asked people, if you can't do it for yourselves, at least think about your loved ones and the risk that you're putting their health at by gathering. I realize it is a change. We've spoken about that at length. This is a significant departure from what is our regular activity and our regular way of being. But we are definitely in a very unprecedented time, and it does call for this level of action if we want to really bring this virus under control.
Just sticking with the topic of buildings.
Just before you do, can I just add before that we did put out, the city put out today something that said, and you can't close the hallways. I mean, people have to get to their apartments. But we said that we thought as a guideline that these buildings, condos and apartments should close non-essential common areas, bathrooms, gyms, playrooms, and so on, and other high-traffic areas, and then also post signage limiting the number of residents allowed in common areas, including laundry rooms and elevators. You'd think you wouldn't have to say hallways too, but I think that we're trying to say to people, almost anywhere in the building except your own apartment, don't gather there together in groups because this contributes to the spreading of the virus. So we're trying to be activist in saying this, but it does count on the condo boards and the individual tenants, most importantly, to actually do what we're suggesting and recommending strongly they do.
Just on that document that I was actually just about to ask you about that. Is there anything that you can do through RentSafe or anything to try and enforce those landlords to make sure that they're putting up their, the sanitation and make sure that they are cleaning high touch areas?
I think the same holds true for this as for every other area of compliance in regard to the directives given and the advice given by public health and the medical officer of health, which is that if people have serious instances of non-compliance where things just aren't done, or where things are even more concerning than that, they should call 311, and we will put that into the compliance system, and we'll try to make sure that all of these are addressed in whatever way possible. And I'm sure that could include the people who are out doing their job if they're out there, but of course I think a lot of these people are not out there as frequently because this is contrary to the advice we've been given and exposes those people who are public servants to the virus and so on. But the answer is yes, people should help us at 311 by telling us of instances where they see non-compliance.
Okay, we'll go online now to Jeff Gray from the Globe and Mail. Jeff, go ahead.
Oh, hi, everybody. Can you hear me all right?
Yes, we can, Jeff.
Yeah, just wanted to ask if there's any update on the number of cases that are associated with the shelter system. Is there any update on positive cases or people who are awaiting tests who are residents of the shelter system?
Just hang on a sec, Jeff. We're having Mary Ann Bedard is here. She can answer that. Just going to change seats here with the chief.
Thank you, Chief. Yes, we had an update as of noon today. We have 4 confirmed cases of COVID-19 within the shelter system.
Okay. And connected to that, I guess, just the other day we were talking about the space between beds in the shelter system. Is there an update on that? My understanding is that the officials are looking at how each shelter is adapting to this new rule of having 6 feet between beds, and that hopefully some mitigation measures can be brought in if that's not possible.
Actually, thank you, Jeff, for the question. It gives me an opportunity to correct some information I gave earlier this week, and I'll blame it on my English upbringing. I got metric and imperial mixed up. So our shelter guidelines require 2.5 feet between beds, which is obviously not the 6 feet that Dr. de Villa is requesting. It's a field hockey stick as opposed to a ice hockey stick. Thank you. But we are working with public health and all of our community operators, as well as in our own shelters, to look at ways that people can create that physical distancing that Dr. Villa is requesting. So we do have our quality assurance staff going out site by site. We have a space analysis that we completed last year that we're looking at. And so although 2.5 feet is a minimum requirement, we do know that many of our shelters do exceed that, and we are working with them on strategies to continue to create that sort of space internally in their programs.
And if I could quickly clarify,
go ahead, Jeff.
The new shelters, though, are 6 feet apart. Is that right? The new ones that have been set up in the wake of COVID-19?
That's correct. The programs that we've opened at the community centres, we've put the beds the 6 feet apart. The original program that we set up at one of our city facilities, they did not adjust their beds when Dr. de Villa came out with her updated information, but that has been brought to our attention, and we have made sure that that has been remedied. And again, that is part of the work of our quality assurance team to go out and make sure that we're helping programs ensure that they are following that as they are able.
Okay, going back here, Mark McAllister from City News.
I'm wondering if, Dr. de Villa, perhaps you can speak to the Wheel-Trans operator that was just confirmed to be one of the cases we're talking about. Maybe any more information you could provide about that and what has been done in terms of that service and how they've adjusted.
So, we don't talk the individual details of cases. However, I can tell you that as with every positive case, the folks back at Toronto Public Health, the case and contact investigation team, is on it. They will do a thorough history and assessment to understand symptom onset in the individual with a positive test, to understand where they might have been, how it might have been acquired, how that infection was acquired, and then look with a very, very careful history and assessment. And it is very detailed, hour by hour, to understand where that individual was and with whom they had contact during the potential period where they might have transmitted the infection to others. We then will follow up individually with everyone who is at risk of COVID-19 infection, whether it's in a workplace setting or in the personal setting.
I don't know, Mr. Mayor, if you can, or Chief Pegg, maybe speak to how this might impact that service.
I think that, again, what Dr. de Villa said is what should apply here, which is that, you know, we're being rigorous in making sure that when instances like this come to our attention through test results or otherwise, that all steps are taken to ensure that, you know, the balance of the service, the balance of the operators are people who are healthy and safe, as best one can tell, and that, you know, while it's a reduced level of service that we've been expected to operate just because calls are way down, all those steps are being taken. And in the aftermath of any of these cases where people delivering public services have been impacted, we take steps to clean and to conduct the kind of investigation that Dr. de Villa made reference to.
Okay,
If I
move
could
back
follow
on.
up, Brad, sorry.
Okay, go ahead, Mark. Yep.
A second question with regard to transit and transportation in the city. The bike share program continues to operate at this point, 465 stations throughout the city. What is being done to make sure these bikes and these stations are staying clean while they're being shared?
I don't honestly, do you know? I don't honestly know the answer to that question, but we will look into that and get back to you before you have to file your story for the day. I just don't know the answer to that.
Thank you.
We'll
But
get
I
that
can
answer.
add one piece, though.
Sure.
That doesn't obviate the need for people to practice good personal hygiene, right? Good respiratory hygiene. So we would encourage people to wash their hands, you know, or use alcohol-based hand sanitizer if hand washing facilities aren't available, right? The notion is to try and reduce the risk, and that certainly would be a key component to that. If you're keeping your 6 feet distance and washing your hands, certainly the risk associated with any bike share station would be pretty much brought down to almost zero, if not zero.
Apologies, Brad. Just to follow up on that then, the messaging from Bike Share and the Toronto Parking Authority seems to be about social distancing, not so much about the cleanliness of the bikes and the stations themselves. That's why
I will
I'm asking that.
undertake for sure to take that up with them and have them change their messaging so as to say to people what the doctor said, is in many cases she's offering the advice we should all follow, which is that it's more about personal hygiene and use of hand sanitizer. And I'll also follow up at the same time to ask if there's any merit. I'll ask the doctor to advise us as to whether there's any merit to doing anything further with the bikes themselves or the stands in terms of disinfection. But I think you heard her say, and we will take to heart and convey to the TPA who runs the bike share program that they should be drawing to the attention of their users that personal hygiene is something that is the most important thing they can do beyond physical distancing to help stop the spread of the virus.
Thank you.
Okay, Mark Douglas from 680 News. Go ahead, Mark.
Thank you, Brad. Quick clarification first for Dr. de Villa, please, regarding the new numbers reported from 1 p.m. The death toll still stands at 4, if I remember yesterday's numbers correctly?
At last count, that's what I have.
Okay, thank you. Just wanted to make sure. So in terms of a question then, you mentioned about how we're seeing the increasing numbers now with the tests that are coming in from people who were infected, you know, several days ago. We're seeing another day with more than 100. We're seeing a day with more than 100 new cases. Do you believe, before this is all said and done, that Toronto could see possibly 1,000 positive cases, if not even 2,000? And on the flip side, are the recovery numbers going to be growing as fast as the positive test results?
So I think we should expect to see similar patterns of increase in the coming days. As I mentioned in my remarks, we know that we've seen a recent return of travelers from March break. And we know that most people who were traveling, on March break and on vacation were traveling in jurisdictions or in areas where there is active COVID-19 circulating. So what we're seeing, I believe, is many of these cases associated with those returning travelers. And as I mentioned in my remarks, we know that the positive tests that we're getting now are the result of infections from several days ago. So I expect we should continue to see that trend in the coming days, absolutely. With respect to recovery, I think we will start to see those numbers go up over time as well. But we'll have to see how that is balanced out with respect to what we see from returning travelers and what we've seen from infections in the last few days.
And follow-up regarding these increasing numbers you can expect. Dr. de Villa, are you getting any closer to what was referred to yesterday as your gentle threat about curtailing civil liberties?
Well, I think, I can't emphasize enough how very important it is for all of us in the city to get behind social distancing and physical distancing. I talked about some instances where clearly we're continuing to see some behavior that's not consistent with good practice of social distancing or physical distancing. We are monitoring constantly what's happening in our city. I will continue to watch the numbers very carefully with the team at Toronto Public Health, and we will make decisions premised on the evidence that we have before us in order to protect the health of the city.
Okay, moving over now to Brian from the Toronto Sun. Brian, go ahead.
Again, I have no question. I'm just listening. Thank you very much.
All right, Brian. Well, thank you. Francine Copen from the Toronto Star.
Regarding the notice that the City of Toronto sent out today urging landlords and condo boards to adopt new safe and healthy health and safety measures, I'm wondering why that was, why it's not mandatory.
So I think in answer to your question, we are relying on our community partners to follow good practice and good behavior. I think we've heard a little bit about the challenges with respect to enforcing, any kind of mandatory order. But my sense is that people are in the city, have expressed interest and concern around what they can do to help control the spread of virus. And I think that if we can, actually all do our part, get behind social distancing and physical distancing, whether we're talking about landlords or residents within apartment buildings or condos, we should not find ourselves in a situation where we need to go to that level of enforcement. The public health practice is always to try to use, an education effort first, least restrictive means. And we've talked about that with many other practices in respect of the city. I think I've heard Chief Pegg talk about that as the preferred method of the city to try to bring people to voluntary, action through education, and only resort to enforcement type measures as needed.
Can I just add to that and say, I think that a lot of the time we rely on people, as the doctor said, to do this on their own. And I live in a condo building, and they, I think in the vast majority, if not all of these items, have acted on this as a board, just in common sense kind of manner. So the first thing I saw when I came out of the self-isolation was a sign showing not only that only 3 people could be on the elevator, but also showing exactly where they should stand in order to be 6 feet apart. So I think a lot of buildings are doing this. A lot of condo corporations have understood that this is the policy that we wish to see adopted across the city and have acted already. And this was really just for those who haven't had an opportunity or who haven't done it yet to tell them it's time, past time.
Thank you.
Okay, we have one more question. Mark Douglas again from 680 News. Go ahead, Mark.
Thanks, Brad. Question for Mayor Tory. Could you explain the good message that you're sending out by leaving the Toronto sign in blue overnight? And I know I know that the lighting up of the sign was supposed to be suspended for as a non-essential service, but you're making an exception here for the blue messaging tonight?
Well, the lighting of the Toronto sign in blue is meant to pay tribute to the workers, especially the health and public health workers and other people who are performing such a vital and heroic role in keeping people healthy and trying to deal with those who are sick. And quite frankly, while we had it purple yesterday to honor those who were who experience epilepsy and raise awareness of that, the changing of the color of the sign involves a keystroke on a phone or a keyboard. And I think, however it might have been defined, it's not really any work that takes longer than a few seconds. And I think, but it's blue most of the time in honor of those workers the vast majority of the time.
Okay, thank you very much, everybody, for coming. Have a restful weekend, stay healthy, and we'll see you here on Monday.